Hello, fellow classmates. My name is Graciela Stanley, and I would like to share with you a little bit about my philosophy of healthcare and nursing. I believe that many, if not most of us, who choose to pursue careers in healthcare are genuinely motivated by a sincere desire to help others, to offer guidance, support, education, compassion, and advocacy for patients in the healthcare setting. My professional journey began as a Spanish interpreter about 15 years ago. In this role, I found a unique opportunity to provide a vital service for Spanish-speaking patients who found themselves often lost and afraid in a healthcare system that they knew little about. I learned over the course of about 10 years as a Spanish interpreter that it was my desire to do more for them than I could as an interpreter, and I was inspired to become a registered nurse. Now, almost 6 years later, I sit here before you, inspired in much the same way as I was then to push myself further and provide even more advocacy and education for patients as an advanced practice nurse. The first couple of weeks in this course have illustrated for me just how difficult it is to articulate my philosophy on ethics in nursing. On the face of it, acting ethically seems simple. To treat each patient as if they were a loved one of my own, offering them the care and compassion and education that I would a family member, is always my goal. Acting in the best interest of the patient should be our primary goal as nurses and advanced practice nurses. Indeed, I believe that one of the characteristics that may differentiate us from medical doctors in our future careers is the unique role that we can provide as educators and advocates. We will bring to the table a unique set of experiences at the bedside that differ from those of our MD counterparts. And in many ways, I believe these experiences will prove to be assets for our patients. We have had the opportunity as nurses to really hone our listening skills, to spend time with patients in the difficult moments, to answer questions in meaningful ways for them and their families so that they can move forward and feel empowered to act in the best interest of their own health. My philosophy in caring for patients is to view them as a whole person, not as a set of symptoms or a diagnosis that needs fixing. We will always be challenged with unique circumstances where we will have to weigh difficult choices. We will have to consider the legal, ethical, and moral ramifications of the decisions that we make both with and for our patients. I believe in acting in ways that uphold our strongest values, and this will always lead us in the right direction. There are certain non-negotiable principles that guide my own actions every day as a nurse and will continue to provide the foundation for my practice going forward. Probably the number one principle that I try to guide my everyday actions by would be respect. Respect for my patient regardless of their background, their reason for needing care, and that includes respect for the choices that they make regarding their own care. Fairness and justice would fall closely behind respect. Treating each person with fairness is an ultimate goal. Compassion. Each patient before me is a human being that deserves my patience, my empathy, and compassion. Ultimately, I would say that to sum it up, for me, my goal every day would be to do the most good and least harm when approaching patient care. In the rare circumstance that my own values, morals, and ethics are challenged in a way that I cannot reconcile, I consider it my duty to ensure that the patient receive the care they need from a provider who is both equipped and capable of giving them the care that they need. It would be my duty as their provider to ensure that they get that care, if not from me, from someone else. Thank you all for taking the time to listen. I look forward to continuing to explore this interesting and complex area of healthcare with you in the weeks to come. Good luck, everyone.